Hello and welcome to the Victress Podcast. I'm Dr. Lisa Marino. Today we have a special guest, Christina King with C&A Benefits, and we are going to get into uncovering the truth, exposing the truth and the lies about health insurance, brokers, advising, all you need to know, really heading into this busy season of benefits, making sure, benefits renewal, decision-making, all of that. And so I wanted to bring in really the experts. Christina is going to be sharing her story as a broker, how she got here, what it's like, being a broker, because I think there's so many decisions, when you're looking at your health benefits, what kind of decision-making you're passing off to your broker. And so we want to make sure that we are exposing the truth about that decision-making process. And I really want to paint the picture of how amazing things can be when you understand this knowledge and don't just pass off this decision to your broker or an advisor. Let's make sure that we're really understanding the entire picture. So, Christina, thank you so much for being here today.
Thank you for having me. I'm so thrilled to be here. You've been such an important partner of ours at C&A to help us get the message out. And I just really wanted to share today that I've been in the business for over 20 years. And there were so many things that as I was a young broker, and I thought I was a really good broker because I did what all brokers do, is just check the market every year, ensure that our groups were getting the best rates, the best health plans that were available out there. And unfortunately, the hamster wheel is that we figure it out a year, and about 9 to 10 months later, we get a surprise and we have to figure it out again. And I was thinking on my drive over that my little personality of rebellion has served me well in what I'm doing now. I think often that the nuns hated me growing up when I was in school because I was always questioning why.
Yes.
And as I was a young broker, I questioned a lot of things, and I didn't get the answers. And I really grew disgruntled with the health insurance industry, and that's one of the reasons I started C&A, is I wanted to do things differently. I wasn't sure what, but I've learned a lot of things, especially in the last 8 years, of what's wrong, what's broken, and more importantly, what we can do to fix it. And Victress has just been a great partner because I think what you're doing with direct primary care in our health plans and with our members is just foundation to offering better health care.
Yeah. Let's paint that picture a little bit because, there's just so much about, the typical story is, right, that we shop out our health plan every year. We try to find the best rates. We want to try to keep our deductibles low for our employees, right? And so that's kind of the typical picture, right? And you were kind of sharing with me before we started that, the average increase is 7%, on their insurance plan, like on their premiums for a small business, and we're both small business owners. We get it. But what other line item do we just accept that? And so if we take that out, over a 5-year period, and we just say, oh, we'll just take the 7%. We'll just take the average, no better, no less, right? And so for like a 100-person company, the average per employee is $24,000,
right,
across the board. Yeah, not just in California, that's here too in the Midwest.
And Lisa, I'd like to point out that 7% is across all companies. So that's big corporations, to small businesses. That's an average. And we all know that small to mid-sized companies are often getting hit much harder than 7% every year.
Sure.
But we did the math.
Yes. So the average of $24,000 per employee per year. And let's take that out over 5 years. So that goes up to $35,000 per employee per year. So
on a family coverage.
Family coverage, yes. And so, you have a 100-person company, that comes out to $1 million increase over 5 years.
5 years.
Yeah.
And so often, I can tell you that my conversation has changed with employers now. Like we're not talking about deductibles. Yeah, that's important, what our employees are paying out of pocket. But when we do the math at 7% over 5 years, and that's $1 million for a 100-person company, I mean, how much are you going to have to sell to be able to direct another $1 million into your health plan, rather than better managing what you're doing right now? And I can tell you, and I have this conversation with employers every day, that they get it. We're all spending a lot of money on health insurance that our employees can't afford to use. I mean, think about it. I see often $3,000, $5,000 deductibles, $8,000, $10,000 out of pockets for singles. double that if you have family coverage. And so for families that give birth, maybe have a surgery in a year, I mean, often that's medical bankruptcy, or they're sending $200 to the hospital system probably for the rest of their life
Right.
to pay off that debt.
Exactly.
And that's broken and it's wrong. And that's one of the things that we're partnering with you, in Victress and other DPCs around the state and around the country, is to bring better health care, because, as I said, we're spending a lot of money on health insurance we can't afford to use, and there's a better way. And my mission, my goal, I think my passion now is to educate employers that there is a better way. And we know everyone kind of knows what's broken, but very few, I think, advisors can share the strategy to fix it.
Sure. So let's, again, paint that picture of I want to get into your story and where you've been, to now where you are, and just kind of know what is possible, because these are incredible plans, and we're excited to be able to offer them, here locally, and this is happening across the country. But share some of the success stories. I mean, you just, you and your company's plans that you've just received some awards. I mean, get us excited for what you're doing. What does that look like?
It's so incredible. I'm going to tell you about, the plans and the awards, and some of our clients are getting recognized nationally in Washington, D.C. as the best health plans in America. And I think we all understand this as Americans. The cavalry's not coming from Washington, D.C. to fix healthcare. And I think it needs to be done locally and in communities with local partners. And so for years, as I was working as a broker, there were things that were happening in our health plans that I didn't understand. We knew there was something wrong. I would get questions, and I couldn't get answers from the industries. And let me give you some examples, because I think we've all experienced this.
Well, so take me back. Was this the first industry that you were in? Have you always been a broker?
No, I've been in the industry 20 some years,
okay.
But I was a teacher.
Yeah.
I've worked in
I don't
education.
think I knew that about you.
I don't know. For some reason, I took to healthcare, the health insurance industry. I was a sponge. I loved it. And I really took pride in being a good broker.
Yeah.
And then I was getting those questions, right? When HSAs came out, right? And then we thought, this is going to make everybody better consumers of healthcare, because we would finally get to see what things really cost. And I could do a whole podcast with you, Lisa, on this, on what's really broken about that.
Yeah.
But I would get questions, simple questions, and I think all of us have experienced this, is that, well, wait a minute, if I run my prescription through the health plan, it's $234. If I use a GoodRx coupon, or I don't run it through my health plan, I pay cash, it's only $17. And I was getting that question all the time early in my career, and I didn't know how to answer it.
Yeah.
And I would either not get an answer from the insurance companies, or it would be something like, well, Kroger's got a special deal. And it never sat right with me, because it was well, how does Kroger negotiate a better deal on this medication than a big insurance company?
Right.
And, and there were no answers out there.
Yeah.
And I think one of the most pivotal times in my career was I went to a conference. I'd watched it for years. Now, I started C&A in 2009, right? When you start your agency from scratch, you don't have a big conference travel budget.
What made you start your own from scratch? Was there anything at that point that really kind of made you, I've got to do my own thing? Or was it more just kind of the entrepreneurial side, wanting to?
I became very disgruntled with the industry.
Okay.
I had worked for other agencies, and I watched us make decisions for our clients that weren't always in our best interest. Okay. I was often told, don't move any more business from this insurance carrier, because you'll blow our bonuses. And again, I was young in the industry. I didn't understand. And I thought, my boss says I can't do this. I have to figure it out for this client.
So what's in, you're working with, Anthem or say, or United or something like that. We have to do something. We have to stay with Anthem, or we're going to lose.
Don't move any more business from Anthem or United Healthcare.
Okay.
Even though I could save the client 15%,
yep.
I was going to blow the agency bonuses.
Yes. Now, is that still the same today?
Absolutely. Absolutely. There's a lot of money in this industry to keep things the way they are.
Okay.
And So I became very disgruntled, and quite honestly, my husband, he was my CFO. He was kind of semi-retired, and he really just encouraged me.
Yeah.
And I think it was just more like he was tired of hearing about it, because I would come home every day and just complain. And he's like, "My goodness, just do this on your own." And so he encouraged me, and I did start C&A in 2009. And when you start your own agency, the way you set yourself apart, because everybody has the same products, right? Everybody's selling the same insurance. And it was more about service, like I don't care if you've got one employee or 1,000 employees. We're
Sure.
going to just service the heck out of you. We're going to make you feel like you're our most important client. And I think everybody kind of experiences that honeymoon phase with their brokers,
Sure.
right? It's just like you get all their attention,
Yep.
and then they move on after a while.
Oh, yeah.
And it happens a lot. So I'm proud to say that, above and beyond is our tagline, and we still have those, honeymoon relationships with our
Yes.
clients,
Sure.
because we're always like an extension of their team working in their best interest.
Well, I think that's actually similar to I would say
Absolutely.
our story is like why I got into it and left mainstream healthcare was our patients deserve better. I'm going to listen to them better. I'm going to give them better care, right? And all of that in the same regard
Yes, absolutely.
was I thought I was just doing a great job just because I could care for my patients better. But there was a whole nother side of the story in cost and in their health plan and how we're delivering things that we're kind of exposing, on the health care side of things that you were seeing. So
On the
what
health
were we seeing on the
insurance.
health plan side?
So, as I was saying, I went to this conference, and
Yeah.
I thought I probably in 2 days I took 2 legal pads of notes, and I thought, I've been in this industry for so long. How did I not know this? I knew all these things were broken.
So was that like Health Rosetta at that point, or what conference?
it
was
was.
Health Rosetta. So how did you how did you find out about Health Rosetta?
I just started following them online.
Okay.
And I thought, well, they're addressing some of the things I've been saying about for years, and they're bringing practical fixes to healthcare. And I wanted to know how to do that.
And Health Rosetta
Health Rosetta is a nonpartisan group of advisors in our industry that are solving healthcare. The fixes are already out there, and we're all just working together to bring healthcare back to the communities and bring better healthcare.
So like a national group of advisors that are
There's about
uncovering the
200
truth and
Yep.
providing solutions and ideas for advisors and small businesses, right? To find solutions
That's
to health
correct.
problems.
Yes,
Right?
yes.
Okay.
So I learned a lot of things, and I got the answer to the pharmacy side.
Okay.
Like, what's been wrong all of these years? And so after I learned that, I thought immediately, I have to take this back to our small employers and our mid-size employers. And pharmacy is the easiest thing you can fix in your healthcare. But during this time, I met a retired CEO, a former CEO of a healthcare system in northeastern United States.
Okay.
And she was a big CEO.
What state do you mind me asking?
It was just a bunch of the
Okay.
New England states
Gotcha.
up there.
Okay.
I mean, it was
A whole
it was
conglomeration.
a whole conglomerate healthcare
Yes.
big
Okay.
system. And at that time, and I think we've all experienced this, our doctors were getting bought up by the hospital systems. And as a broker, and as a consumer of healthcare,
Yeah.
we think, okay, this is just a trend in healthcare. The doctors are getting ready to retire. They can't compete with the big hospital system, so they're selling their practices. And out of the goodness of the healthcare, the hospital systems, they're just buying these doctors' practices to continue to bring care to patients.
Sure.
And I thought that was how it kind of went. And then as I was talking to, employees in meetings, and they were saying, hey, I went for my preventative care visit, and then all of a sudden I got a bill for $300. Like, this insurance stinks, because, and I had to do deep dives because this kept happening more and more, like what's really going on.
Sure.
And so patients were going to get their preventative care visits, and then they would say, I've been feeling tired lately.
Yeah.
And then, right, the switch flipped, and then it became diagnostic visit, and then they ran a bunch of tests, and then they referred you to specialists. And I kept getting this question all the time, and as a young broker and not really understanding, I'm like, well, I don't know what's going on.
Sure.
I learned from the CEO, the former CEO of this health system. She was such a dynamic and intelligent and knowledgeable woman, and she spent some time with me, and we spent a lot of time talking about why hospital systems are buying up primary care. And unfortunately, a lot of these doctors are good doctors. They want to provide good medical care.
Sure.
So she told me that when her hospital system was buying up the primary care practice, that they would lose about $250,000 a year on that primary care. But the primary care was meant to generate about $2 million in revenue for the hospital system.
Yeah.
So what happens is your doctors have quotas. They see you for about 7 minutes, and they're coming in with an exit strategy already of, okay, here's a prescription, here's a referral for a specialist, and what happens is you're not getting good care.
Sure.
You're getting referred out for probably tests that you don't necessarily need often, right?
Sure.
You're getting prescriptions. Like, the answer is not always just write another prescription.
Sure. I can verify that on the health care side of things, because we have a collaborating physician that has divulged that he says, here I am, I'm doing the best job that I can.
So that we can.
Oh.
I was drinking, right?
Oh, no, you're good.
Okay. My mouth's getting dry.
One of our collaborating physicians has come to us, and has revealed that about being in a health system, that he's saying, here I am thinking I'm doing a really good job because I'm getting my patients better, I'm keeping them from going out into the system. And he's hearing from upper level management that is saying, oh, no, you have the lowest amount of referrals. We need to get that up.
Yeah,
so,
exactly.
So we're hearing that, and we
Yeah.
know that physicians are hearing that. And he's saying, no, this is not why I got into medicine. I want to help my patients. So,
So I met the CEO because of the former CEO of the hospital system, because then her passion became, and here's why. She was at a CEO conference, hospital, big conference, and the hospital executives were talking about, well, how do we generate more revenue?
Sure.
And it was at that time a lot of unbundling of services, like how do we turn a $5,000 procedure into $15,000? And a lot of the talk was around the primary care practices in the hospital systems now. How do we get them to generate more revenue into the hospital? And she stood up and said, well, you know what? If we were managing our primary care better, so many of these patients would never even make it to our beds in the hospital.
Yeah.
And she said everybody's eyes just got real big and said, quit talking like that. That isn't the way our healthcare system works. I mean, our job is to generate more revenue and keep our profits up. And so eventually she resigned, and her role and her passion really became setting up primary care practices, direct primary care like Victress around the country, near site, clinics for employers and communities. And so I'm listening to her, and I thought, oh my gosh, that's one of the things that we all know is broken in our healthcare, right? Because primary care became the loss leader in our healthcare, and it needs to be the foundation. And I thought, how do I build this into employer plans, right, for small to mid-sized companies? Because big corporations have been doing it for years, and many of them do it well. Mm-hmm. They've got the on-site, near-site clinic,
Sure.
and they see the value
Sure.
of doing that. And then we met you, and we met other direct primary care around the country, and it was really like, this is how we provide better health care, where when done right, we're not our members aren't getting to those hospital beds. They're not getting, to the not necessarily needed surgeries. And
Sure.
we have the statistics, and I've heard you talk to employers about it, and we have the statistics both in our communities
Yes.
and nationally,
Yes.
where hospitalizations,
60% decrease.
60% decrease in hospitalizations.
Yes.
A huge decrease in prescription utilization.
Yes, at least a third.
Yeah. Specialist visits.
Yes, like 40%.
It's amazing.
Yeah.
Yeah. And we were talking about this before we started. We hear this in our industry, and I know you hear it from employers, and we do as well. Well, I don't know if we're ready for direct primary care like Victress. It just sounds, I don't know.
Too good to be true.
Too good to be true, or this new like,
and
let's
different.
let somebody else.
Yes, yeah.
And you know what it is? I say this to employers all the time. It's getting back to the good old-fashioned healthcare that I grew up with. I mean, where you had a relationship with your doctor. You spent as much time as you needed. They knew everything about you. The answer isn't just write another prescription.
Yes.
It's actually getting to the bottom of what is going on and with their health.
Yep.
And
we always say, like, oh, can you pull out your cell phone and text your doctor? Because I can,
Yeah.
and
I'm a patient, I know.
Yes. Yeah. And it's that simple. And I think, if I could simplify down why we're where we are at, is, are we putting the patient first, or are we putting the shareholder first? And I think that's across the board a lot of problems in America right now, but are we putting the patient first or are we putting the shareholder first? And I think that's where I think small business owners, if I can speak to that, are hoping that they're not in that, bucket on the left side of, we just, we're getting, used for our profits, or are we actually, putting our employees first? Are we able, are we saying that we can do that? And that's why I think, we're seeing lawsuits come about now, like Johnson & Johnson have, employee class action lawsuit that they're finding out about this.
They're charging way more.
They're charging me 5 times than I should be. Right. And so they're finding out about this scheming. Right. We need to be able to get the best price that we can. And now I'm getting hit as an employee. I think we're only going to see more and more of that on the large corporation side of things. So there's that side of it, too.
I love working with small to mid-size, especially like family-owned, closely held businesses, because we're talking to a business owner, and we do this so often, and I explain it like from a business perspective, direct primary care, right? Our traditional primary care in our health system, it's a fee for service, and so the more times, right, that you're going to the doctor, the more they're referring out to specialists, procedures, surgeries, they make more money. The more they see you, the more they refer you out, the more you get done. That's our traditional healthcare system. What you do that I love so much, and I explain, like, you're more profitable if you have better outcomes for your members. Right? Because you're getting paid a monthly subscription fee, regardless if that employee, that member is in your office every day, every week, and so your goal, right, is to get that member onto a journey of better health so that they feel better, maybe weaning off some meds, maybe, just getting them to a point where you can talk to them daily, text, or, but they're coming in quarterly. They're coming in, twice a year for those checkups. And that's how you see more patients. I mean, that's how you're more profitable, is by providing better care and having better outcomes with your patients.
Yes, we're incentivized to provide more value. If I don't do an amazing job of providing value to our patients, they're gonna leave. They're gonna see you later. Versus in traditional health system, it's about volume. It's just how many patients can we see, and that's why you're seeing the quality dip. That's why you're seeing patients not even go to primary care. That's one of the rebuttals that we hear from either the brokers or the business owners, saying, well, we have primary care. We already have, coverage for this. Why do we need to change? Why do we need to do something different? We're not even utilizing primary care like we should be, or we can't even access it because the health system is incentivized to send them to urgent care, send them to ER. We're overburdening primary care rather than
imaging, get more
preventing it. Yes.
I just absolutely love your model. And I know we've talked to employers together, and we hear this all the time. Why isn't my broker talking to me about this? And I think my passion, my goal, my mission now, I've sold enough insurance, right? It's just to educate employers about, like, this isn't a wellness strategy. It's not something you plug into some fully insured health plan, right? It's just like, you can, but you're not going to get the full return on your investment. And I think a big thing that I tell employers all the time, a lot of times your broker's just not sharing this because they don't know, or they're not allowed to tell you. Just as I shared with you stories of, don't do this because it's going to cost us money from a broker perspective. Don't move business. Don't do this. So this is harder, right? Because there's harder in a perspective of, it's more education. It's getting employees to realize there's a better way, employers to realize there's a better way. It's more work, but it's so much more fulfilling. And we're having such great success. One of my best implementations that we did was the CFO, the CEO, they all just bought into this. And they said, yes, when we explain what's broken, they already know what's broken. Yes. They just don't know what to ask. So we explain again, what's broken and the fixes. And the fixes are just common sense. I
Right.
mean, it's just like we just haven't asked the right questions, or we haven't equipped employers to ask the right questions. But the CFO walked in the room as a manufacturer, and all the employees are sitting there with their arms crossed, like, it's open enrollment season again. What's going to happen? What are they going to do to me? The CFO walked in and said, hey guys, remember that 20% raise everybody got last year? And the guys are like, what are you talking about? Like, and he goes, oh, that's right, we gave it to Anthem. And, and everyone kind of chuckled. And he said, we're going to do something different this year because we want to take better care of you. We want to give you better health care. We've got projects we want to do. We've got new equipment to buy. We're not just going to send this money off every year and then see what happens next year. So listen to Christina, listen to Lisa, because this is all about you.
Yes.
And then us.
Yes. Well, one of the health plans that is up for the awards is with a local company here in Sydney, is Solman Electric.
Yes.
And their CEO, Jeremy, was great. And he sees the writing on the wall, and that's when they get it. They're like, we've got to change. We've got to do something different. Or he just said, it's 7% this year, or 10% or whatever it is. But it's, again, in 5 years, it's this. So we're getting off that track, And
it's
so
not sustainable what we're doing. I mean, we realize that from our industry. Employers realize this. We just are all spending a lot of money on health insurance right now that no one can afford to use.
Right.
Yeah.
And he stood up in front of the employees and he said, together, you all collectively spent an average of like $4,400, as a family, each of you individually on your, out-of-pocket costs, every year. And he said, here's that money back to you. Here's your raise. This is what we're doing. I'm giving this money
we can
back
send it
to
off
you.
to the insurance
Yes.
companies, or we can give it back to you.
Yes, and they're up for their finalists for one of the regional awards for the Health Rosetta Rosie Award, and they have zero deductible. Mm-hmm. They have no copays. As long as they interact with primary care, then they have pretty much free range. Find the best high quality providers, and these are the health plans that are really, I would say, we're simple and accessible, and they're not paying an arm and a leg for it. I'm pretty sure their costs were flat or negative, correct?
That's correct. Yeah, they were flat. And so they didn't take the big increase that they would have with the big, insurers. And, but yeah, we have quite a few groups up for national and regional Rosie Awards with Health Rosetta. And those are just some of the best health plans, best health strategies in America. And we're very proud of that. And you've been an integral part of that in helping us educate employers.
Sure. Yeah. Well, it's not just us. So tell me about the City of Bell Fountain plan, because we have some of their employees, but most of their employees are with one of our partners, Hickory.
Yes.
Hickory Direct Care over in Bell Fountain. So what was the City of Bell Fountain plans look like? Because I think it's really fascinating to kind of uncover what other companies are doing.
I'm so excited.
Our municipalities, obviously.
Yeah. I'm so excited to share our journey together in Washington, D.C. with the City of Bell Fountain. And that journey kind of started a couple years ago. And Logan County had been trying for 5 years to start a community health plan. They got it that, again, Calvary's not coming from Washington. We want to do something here locally. Let's buy local. And let's take care of those in our community. And so I had the privilege of getting in front of their hospital executives, and I found that we're finishing each other's sentences. Like, I thought hospital systems and insurance companies were in cahoots together in this whole thing.
Right.
We're finishing each other's sentences about what's broken in health insurance, what's broken in our health care. And we said, let's do this. And City of Bell Fountain was one of our our earliest adopters, and they were getting significant double-digit increases every year.
Sure.
And they were being told that it is what it is. There's nothing you can do about it. You're high risk. You've got a lot of utilization. And so I got introduced to them. We went in and we put direct primary care, Hickory Medical, in. No, actually, they had direct primary care.
Yes, they had already had direct primary care for a couple of years, I think.
And, they had probably about 50% utilization.
Sure.
And we said, no, the city's going to pay 100% of this.
Yeah.
The employees are going to have access to good primary care. They formally had it on top of a big insurance company plan. So every time they would get a 40% increase, it's like, well, okay, now we have this added cost. What are we going to do?
Yeah.
So we put in a health plan where the whole health plan is centered around direct primary care. And a lot of the care is managed there. So a lot of claims come out of the health plan because it's covered under.
Because we're not sending the claims
Exactly.
to the insured, just a direct.
You're doing everything in, a lot of things in office.
Yes.
Spending a lot of time with employees, helping them understand their health and getting them on a better journey,
Sure.
Health journey. We contracted directly with the local hospital systems.
Yes.
And can do another whole podcast on what I've
Yes.
learned, because now we have CEOs and executives from other hospital systems around the state reaching out and say, we want to do what they did in Logan County. We want to do what they're doing in Shelby County.
Yes.
And that's really, really exciting
Yes.
about it. But so the city of Bellefontaine went from a $5,000 deductible. They were getting huge increases to a $0 deductible, $0 copays. And our message is buy local. And everybody has free access to direct primary care. If you keep the care local and can be managed by the local hospital system, there's no deductible. If there's $0 copays for specialists at the hospital system and mental health, and just we're working really hard to support the local pharmacies.
Yeah.
So employees have $0 copays for generic medications at the local pharmacies. They can use the bigger chains, but we're supporting our local
Sure.
partners. So they have about 75, 85 employees on the plan. We saved them almost $800,000
Wow.
in first year.
Wow.
Just carving out a bunch of the fraud, waste, abuse, and overspend in their health plan. And ultimately, we gave employees better health care.
And that was hard savings too. I mean,
Oh,
that's
that
just
was
not
hard.
like,
That was-
we'll see that next
Nope,
year. Like
that was
this
premium savings. That was
Yes.
actually hard cost to the plan.
Yes.
And so employees can absolutely have the freedom to go wherever they want to go.
Sure.
But we've built a good health plan around that local community. If the care can't be managed in that community, they can go to high quality hospitals and still have that $0 deductible plan. So ultimately, I've had people stop me in the streets and say, thank you. This is the best health plan. I've been with the city for 17 years. This is the best health plan we've ever had.
Yeah.
And I'm so thrilled with that. I feel like my
Yes.
work's done.
Yes. Yeah.
We're just beginning.
It's just beginning. And I think the whole point is not like this is not just us. This is not just our little microcosm here. Like this is happening across the country.
Across the
And we
country.
want as many business owners, as many advisors. We want as many players in healthcare to see this, to understand there is another option. You're not just pigeonholed into accepting the renewal.
And you're not being a guinea pig. Like you're not
Yeah,
the
yeah.
first employer
Yeah.
to step up and do this.
Yeah, you're not-
Like
yeah.
the solutions, the fixes are already out there. And what we've built right here in Shelby County and in Logan County and other counties in Ohio, it's can be replicated.
Yes.
We've got great transparent vendor partners. And so it can be replicated all over the place. We don't have to recreate the wheel with every employer.
Yes. That is amazing. Thank you so much for sharing that. Is there anything else that you would like to share with whoever may be listening, HR professionals, even employees, especially C-suite or business owners, to encourage them to think and look differently at their health plan?
Well, I think, you and I were talking about this before we started. I think we've reached a point in our history where everyone's questioning, like, why? Like, really what's going on, right? And I think that in our healthcare system, so many, like, it's okay. It doesn't have to be this way. It's okay to question. And if you don't know what to question, like, we'll give you the ammunition because we know what's wrong. We know what's broken. We have the fixes, for
Yeah.
it. It is what it is, ever. So I say question everything. Be that little Christina King that was making the nuns crazy, right?
Yes.
Just like question everything and just say there's a better way, and I'm going to figure it out. And I owe this to my company, to my employees, to their families. We can't keep strapping Americans with these huge out of pockets and letting them figure it out on their own. It's not hard. It's really common sense, like solutions.
Yes. Thank you so much for sharing that. For me, it is picturing that patient. I mean, I have conversations every week with patients that are saying, I've got to find something different. our healthcare is too expensive. You know, it happened the other week. We had talked to the company and they're saying, oh, no, we're not ready for that. You know, we don't want to change, you know, and then literally like the next week or two later, I didn't know this, but the patient had come to me and they were like, hey, we're thinking about, you know, finding our own insurance, you know, and I'm like, oh, you know, here's some options, you know, what do you think? Cause they're like, oh, we have a small business, you know, whatever. And they're like, I'm like, oh, what do you currently use? Oh, we use my spouse's plan, you know, and it was that same company that didn't want to change. And they're telling me my deductible's too high. I can't even use the insurance that I'm paying for. And I'm like, oh, if I could just.
And on average, we're paying almost $25,000 a year.
Yeah.
Right. For insurance that families can't afford to use.
So if you're thinking your employees are not having that conversation with themselves, they're wondering, you know, they don't think there's an option either. And so we are trying to educate our patients as much as possible to say, talk to your upper level management, tell your CEO, your CFO, your HR manager, whoever, that we need something different. This is no longer acceptable.
You mentioned earlier the lawsuits that we're seeing pop up with employees suing their employers, right?
Yes.
And I think and I don't mean this to be scary, but kind of in a way I do, is that as an employer, you are a fiduciary of your health plan. And you have, right? You have this obligation to every year or, you know, just ensure that you're offering the best health care to your employees at the best pricing.
Sure.
And that's more than checking the market. So you know, we hear this a lot. Oh, I've had my broker for 15 years. Jim and I golf together, and you know, and that's fine. That's a relationship. But as fiduciaries of your health plan, you are required to. Yeah. You should be checking that. You know, the sustainability, the cost of your health plan, like what you're offering.
Sure.
Yeah.
What are the next steps? You have HR professional, CEO, CFO, even an employee. What are the next steps if they're just hearing about this for the first time, or maybe they've heard of it and they don't really want to believe it, but what should they be doing next?
I'd say, again, question everything, but definitely reach out to you, Lisa, reach out to me, and we're not there to sell you anything.
Yeah.
I mean, we're there to educate. And I think that's where we're so aligned in that we're passionate about educating employers about what's out there. And so it's just like, reach out to us. We'll come out, we'll have a conversation, tell us what you think is going on, and we'll share with you what we know. We're going to give you the information. We'll show you how to fix it. And ultimately, it's up to employers to make the decision they think is, you know, in the best interest of their company. But start having those conversations. We have employers that are yes, like, let's do this.
Yes.
This is so broken, I want to fix it. And then you have, we're not ready this year. And then, you know, we always say, well, we'll see you next year.
Absolutely.
Because you're on the hamster wheel.
Yes. And they're only going to see the writing on the wall.
Exactly.
It's a matter of time. Thank you so much for being here. We will definitely put Christina's contact information in the comments. Please be sure to like, share, subscribe. Please, especially if you're an employee and you were hearing about this and your mouth is just like dropping, you know, and please share this with your upper level management, whoever you know, business owners, right? HR professionals. This needs to become the forefront. This is the number 2 cost line item in your budget, right? So we need to bring this to the forefront. And especially, you know, I always say, like, you know, we all pay our school districts, we all pay our taxes, right? Like, this is really important in our schools. This is really important in our local government. All the money that we're doing, like you said, that 20% fluff, right? We want to be putting that to good use and not just, you know, throwing it away, right? For extra profit. So please share this with business owners that you know, and let's get the word out there, because this is a matter of, and we've had it before, and I've shared stories before, this truly becomes a matter of life and death when we're talking about somebody's healthcare. Whether it's medical bankruptcy, whether we've had, you know, folks with kidney failure, we've had folks with nodules, you know, get discovered, right? There's all, you know, this is life and death, and it's also, you know, it's killing our, you know, Americans, right, with the cost. So thank you so much.
Yeah. Let's get smarter, America.
Yes, absolutely. All right. Thanks so much for joining us, and we'll see you next time.
Thank you.